Hey guys, I'm Annalisa Alvarez. I am here in the classroom that we would be using if we were meeting in person. So what I'm going to do today is I'm going to make just a little, hopefully keep it short, video where I'm going to walk you through the cast that you have hopefully picked up from the library by now. So this is your little 20, I think they're 22-inch skeletons that you are keeping at home this semester for use in this class. Right now you're working on chicken bone experiments, but pretty soon we're going to get into looking at the bones and what we can learn from the bones. So again, this is a copy of the cast that you have at home. These are the teaching casts. This is the life-size teaching cast that we would be using in the classroom. What I've done is I have laid out our disarticulated skeleton. He's all laid out in anatomical order, all the bones in place and so on. And I'm going to walk you through looking at these life-size bones and where they are on your cast. So that as you start working through the labs, you'll hopefully kind of be able to use this cast a little bit better to kind of understand which bone am I looking at. So we're going to start at the top and we're going to work down, but we're mainly going to focus on what's called the postcranial skeleton. The cranial skeleton is your cranium, which is the top part of your head, holds your brain and has your facial bones, and the mandible, which is your lower jaw. Those two together, cranium plus mandible, are the skull. But we're going to have a separate module on that, so I'm not really going to focus on that because the skull and the mandible, or the cranium and the mandible, are pretty easy to recognize and identify. So what I want to focus on is everything underneath your skull, which again is the postcranial skeleton. So let's start with what's called the axial skeleton, which is down the middle part of your body. So this part of your little skeleton. Here's your axial skeleton. And we'll start with these bones up here. These are the cervical vertebra. You'll notice they're really flat because their main job is to hold up your head and to rotate your head. So the cervical vertebra are located here, right underneath your skull. Okay, so that part here, these are your cervical vertebra. Again, you can tell they're cervical vertebra because they're pretty small and pretty flat. Okay? Right underneath those vertebra are your thoracic vertebra. Your thoracic vertebra are the ones that hold your ribs. So on your skeleton, the ones that the ribs attach to are all the thoracic vertebra. You can tell they're thoracic vertebra because they have two little arms, and those little arms are what your ribs attach to. Okay, so here's your thoracic vertebra, and here's where they are on the skeleton. Again, you know it's a thoracic vertebra because it has these two little arms that stick out. Then, down at your lower back, right down here, are your lumbar vertebra. You can tell they're lumbar vertebra because they're big and heavy. They have to hold up the weight of your entire upper body. So they're holding all this weight. So these lumbar vertebra, again, you can tell they're lumbar vertebra because they're pretty large and heavy duty. All of the vertebra have this hole through the vertebra. That's where your spinal column goes. So every single vertebra, whether it's lumbar, whether it's thoracic, or whether it's cervical vertebra, has that little hole. Again, cervical, thoracic, lumbar. Okay? Your spine sits on top of your pelvis. So your pelvis has three parts. It has two os coxa and a sacrum. So we'll take a look at the sacrum. Sacrum is basically the bottom part of your spine. And it's a bunch of vertebra that's all fused into one bone. So by the time you're an adult, this is all fused into this kind of V-shaped bone. Again, this is at the very bottom of your spine, so right down here, and it forms part of the pelvis. And it's, again, at the very back part of your pelvis. So there's your sacrum. Your two os coxa are the two sides of your pelvis. And os coxa is kind of a weird bone. It's often, when you're first learning osteology, it's often kind of hard to orient it. So this big blade part here is what you put your hands on when you put your hands on your hips. And that is right here in your pelvis. So right up here. This is the front part. This is called the pubis. We'll be looking at this when we determine age of a skeleton. So this is the front of your pelvis right up here, pubis. So ilium, the blade, pubis, the front part, and then this is the ischium. This is what you're sitting on when you're sitting down, and the ischium is right down here. So it's basically the sort of bottom part of the pelvis. Okay, so here's our pelvis. We've got 2 os coxa and a sacrum. All together, those form the pelvic girdle. Okay, so now let's look at the limb bone, or the appendicular part of our skeleton. So we're going to go back up kind of towards the top, and we'll start with our collarbone, or clavicle. So a lot of people call these collarbones. Here is your collarbone, and again, it's right here at the very top, kind of like right up under your neck. So clavicle, right up here under your neck. Again, kind of a long, thin bone, goes out to form part of your shoulder girdle. Another part of your shoulder is your scapula. People often refer to this as your shoulder blade, kind of a triangle-shaped bone. Your scapula is on the back of your shoulder. So your scapula is these 2 bones on the back of your skeleton. So notice how they're kind of on the back, behind the head there. Okay. Then on the front, we have the bone called the sternum. This is right down the middle of your chest. Here's your sternum bone. Notice it's a long and flat bone. So long and flat, and again, right down the middle of your chest. You can feel your sternal notch at the base of your throat. You put your finger up there. Again, long, flat bone, sternum, right down the middle. You can see the bottom of the sternum down there. Then, of course, you have a whole bunch of ribs. You have 12 left ribs and 12 right ribs. And the first rib is an unusual rib because it's very broad and flat compared to the other ribs. So the first rib is right up here underneath your clavicle. So again, here's your clavicle, here's your first rib, and then you have 11 other ribs on either side. Ribs are fairly easy to identify. They're these kind of C-shaped bones, kind of flat. They have a little head at one end where they attach to the vertebra. And again, 12 on the left and 12 on the right. Okay, let's do our arms. One of the bones that we'll use in this class for determining things like stature is the humerus. This is your upper arm bone. Notice it's kind of flattened and broad at the bottom. This is your elbow joint, and it has a kind of round head at the top. So here's your humerus, upper arm bone. The round head is part of your shoulder girdle, and the broad, flatter bottom area is part of your elbow. Okay? Then we have the 2 bones of your lower arm. We have your radius. The radius is underneath your thumb, and the ulna, which is underneath your pinky. So these bones are down here, the lower arm bones. The ulna is easy to remember because it has a kind of U shape at the top. So ulna, U-L-N-A. And again, those are the 2 bones of your lower arm. So radius is underneath your thumb on your skeleton. Ulna is underneath your pinky on your skeleton. Then at the bottom of each arm, of course, we have our hand bones. I did not put out all the disarticulated bones of the hand because we won't really talk about them and use them that much in this class, but here you can kind of see what your hand would look like if it was in pieces. So what we have here is the carpals, which are the bones of your wrist. The carpals are sometimes fractured if you fall and land on your hands. You have the metacarpals. These are the bones of your palm. So on your skeleton, your carpals are little bones here. Your metacarpals are the bones of the hand. And then your carpals are the bones of your fingers. I laid this one out because these are the bones that we're talking about with respect to our chicken bone experiments. So remember, we had this victim, her pinky had this damage to it, and we're testing with the chicken bones to see whether it could have been caused by car door slam. So here are the 3 bones of a pinky. This larger bone is the one close to the palm. The little skinny bone is the one at the very tip underneath your fingerprint. And this bone was the one that was missing. So the tip one was missing. This bone in the middle was the one that had the fracture across it. So that's the one that we were actually testing with our chicken bone experiments. Okay, so that's why I laid those out. Okay, and again, of course, you have a left and a right arm. So now let's go down to our lower skeleton. So we have looked at all this stuff up here, our humerus, radius, ulna, hands, our ribs, our sternum, our scapula, our spine, our ribs, I just mentioned that, or pelvis. Again, pelvis is pretty important because we use it for both determining sex and age, so keep that one in mind. But now let's look at our lower limbs. So the femur is also going to be important because we're going to use that for determining how tall a person was. So the femur is your thigh bone. On your skeletons, they're right here, right here. And notice the femur, it's the longest, biggest, one of the most sturdy bones in your body, very difficult to break. It's got a bottom or a distal part, which is part of your knee joint. Notice how it has kind of two lumps. That's how you can tell that's the knee joint part. And at the top, it has, again, a round head to it. So that round head, which is up here on your skeleton, so here's your knee joint, here's the round head. That round head actually fits into this part of your pelvis. So there is your hip joint. So notice that big, like a cup in your pelvis, that's where the head of your femur fits. So femur or thigh bone right here on the skeleton. This particular disarticulated skeleton does not have patella, which are the kneecap bone, that little lumpy bone you can feel in your knee. But that right there is your patella, right on the front of your femur. It would lay right here if this one had patella. For some reason, this cast did not come with patella. So again, you've got a left and a right femur. And again, on your skeleton, there are these bones right here. Okay? Now, the bones of our lower leg, just like with our lower arms, we actually have two bones in the lower leg. So we have a tibia, which is this bone. This tibia is the bigger bone. So notice how you've got two bones. One is kind of big and thick and the other one's skinny. So the tibia is the big one. And you'll see it has a broad, flat surface. That's part of your knee joint. And it also has this little hook at the bottom. You can feel that bump on the inside of your ankle. So that bump is actually part of your ankle, that little lump or little projection there. So your tibia is, again, this bone right here. Your fibula is the skinny bone. This bone is on the outside of your leg. So notice it's on the what's called the lateral or the outside of your leg. And again, you've got a little bump down there. That's the bump on the outside of your ankle. So a little kind of teardrop shape down there. And again, it lays on the outside of the leg. So again, tibia here and fibula on the outside. Then, of course, you have your foot bones. Here are your tarsals. These are the big, heavy-duty bones of your feet. They have to carry a lot of weight. The biggest one is your heel bone or your calcaneus. You've got your metatarsals, so the bones kind of in the arch of your foot. And then here, again, you've got the phalanges, or the little tiny toe bones. So that, again, is your entire skeleton. Let's just kind of go through it again real quick. You've got your skull, which is cranium plus mandible. You've got your cervical vertebra. You've got your thoracic vertebra. You've got your lumbar vertebra. You've got your sacrum down at the very bottom of your spine. You have the two sides of your pelvis. Those bones are known as os coxa. You have your clavicle, or collarbone. You have your sternum down the middle of the front of your chest. You have your ribs. You have your scapula, your shoulder blades here on the back of your rib cage. You have your humeruses, your two upper arm bones. You have your radius and ulna, lower arm bones. And then you have the bones of your hands. You have underneath your pelvis, os coxa and sacrum. Underneath your pelvis you have the femur, two femurs. You have the patella, the kneecap. You have the tibia and fibula. So tibia is the big bone, fibula is the long skinny bone, and then the bones of your feet. Okay, hopefully that helps. Be in touch with me on Canvas if you have any questions, and I'll talk to you later.